Once the patient name is selected, the initial test prep screen will appear. Take a couple of seconds to verify the patient's name, ensure that the transducer icons match the transducers you are using, and that the appropriate ear or ears are selected. Then, press the Start button to begin the impedance check. There's an illustration with a color-coded dot at each electrode site that will turn orange or green. The numerical values at the bottom of the screen will show the actual impedance value for each electrode. The lower the number, the better the impedance and the faster the test. It is recommended that the impedance value be 10 kiloohms or lower for all 3 electrodes. If they are not, stop the impedance check, remove the snap electrode corresponding to the high impedance, re-scrub, and reapply the electrode. Retest impedance and proceed with the screening. If impedance is greater than 50 kiloohms at any electrode site, the AABR screening will not begin. The testing screen displays 3 key pieces of information to observe. First, the bar graph or graphs in the center of the screen will show the progress of each ear toward a pass result. The red bar indicates the AABR response from the right ear, and the blue bar indicates the AABR response from the left ear. Second, there is a noise bar that displays the amount of noise measured during the test. A check mark in the bar indicates that the noise is not interfering with the evaluation. The check mark will disappear when the noise is too high. Third, the time bar is a progress bar to keep track of the test time. The test will last a maximum of 3 minutes. The test will conclude when both ears have met the criteria for a pass result or the maximum time has been reached. It is possible to test one ear at a time when using the ear cups or ear tips. Touch the ears icon on the top right of the screen to toggle to the test ear. If you are using the OAE probe for AABR, a single ear icon will be visible and will toggle between right ear and left ear. The right ear is red and the left ear is blue.